Hi guys, welcome to Pathopulse underscore Radhika. So today we have a clinical scenario based discussion. So the history is a 28-year-old male presented with pain and swelling in the right knee. X-ray and histopathological image of the biopsy is given below. What is your diagnosis? And here we have an X-ray. Are you able to find the lesion here? See, you have a lesion over here. Okay, it has got a margin. It's a well circumscribed. It's a circumscribed lesion. It is radio-opaque or radiolucent. See here, it's a radiolucent lesion. It's a radiolucent lesion. And when you see the periphery of the lesion, you have sclerosis. Okay, so it's a benign lesion. Okay, it's a benign looking lesion. And most important, whenever you're analyzing an X-ray, reading an X-ray, look at the location of the lesion. That gives a lot of clue to your diagnosis. Okay, so which part of the bone is this lesion located? So it's located in the epiphysis. Okay, so it's basically a young male, a male in the second decade, epiphyseal lesion, benign radiolucent lesion with sclerotic margin. So from this level, what your mind should think next is, what are the tumors which can occur in the epiphysis? Then does this X-ray appearance fit in with that diagnosis? Okay, so next we'll go for the histopath image. So I'll just summarize it. A male in the second decade, a benign lesion, bone lesion, epiphysis, radiolucent with sclerotic margins. Meanwhile, just think what are the lesions which occurs in the epiphysis of the bone. Okay. Now we'll go to histopathology. So this is the histopathology image. So what are you seeing here? I know all of you, your first thought would have been a giant cell tumor. We'll discuss that later, but this is not giant cell tumor, okay? So always don't jump only with some part of the question being read. Look at the histopath image also, okay? So what you're seeing here is, you can see some pink stuff, okay? All these pink areas. So those are nothing but cartilaginous areas or cartilaginous matrix. And look at these cells, large cells with so much of cytoplasm. The pink stuff is the cytoplasm. Okay, so these are nothing but chondroblasts. They are chondroblasts. Okay, so next here is your catch. Anyone? So you have something like a meshwork. Okay, you have something like a meshwork, like a chicken wire. This is called chicken wire calcification. Now any clue what it is? So you have a chondroid matrix, cartilage in a chondroid matrix, chicken wire calcification, large cells with abundant eosinophilic cytoplasm, and few giant cells. So what's your diagnosis here? So the diagnosis here, an epiphyseal tumor, okay, a benign tumor. So what did you see in the histology? A cartilage forming tumor, eosinophilic chondroid matrix. Then you have chicken wire calcification, okay. Then radiologically you had a radiolucent lesion with a sclerotic rim. So all these put together, your diagnosis is chondroblastoma. Chondroblastoma. So what is chondroblastoma? So chondroblastoma is a benign tumor, a cartilage forming tumor. So can anyone tell some other cartilage forming tumor? So what are the cartilage forming tumors? Osteochondroma. Okay, then you have chondromas. Then you have chondromas. Then you have chondroblastomas. In chondromas, you can have enchondromas also. Okay, so these are the benign cartilage forming tumors. Okay, so chondroblastoma usually occurs in the epiphysis of the long bones. So chondroblastomas occurs in the epiphysis of the long bones with a slight male preponderance and occurs in the second to third decade. Okay, and they can have this chicken wire calcification and a chondroid matrix. It's a cartilage forming tumor. Okay, so what is this one? This is also a cartilage. See, this top one is a cartilage. Cartilage appears pink on histopathology. Sometimes it can be blue also. So it's a cartilage forming tumor. Okay, it's a cartilage in a scab. Here you have bone and enchondral ossification. This is how an osteochondroma looks like. So just I have put osteochondroma here because for you to just compare and contrast. So you would have seen this pedunculated lesions, right, in the bones. So those are osteochondromas, which has got a cartilage cap. Then they have enchondral ossification. Then they have bone. Okay, so just for comparison. So having discussed all these, I'll just summarize about chondroblastoma. So chondroblastoma is a benign cartilage forming tumor, usually occurs in the second and the third decade with male preponderance. You can have a chondroid matrix. You can have chicken wire calcification. It's not that always you get to see chicken wire calcification. Sometimes you may not see also. Usually occurs in the epiphysis of the long bones, and it's a benign lesion, a radiolucent lesion with a sclerotic rim. Sometimes you can have calcification also. So this is about chondroblastomas. Okay. So I told chondroblastoma occurs in the epiphysis. So the moment I told about epiphysis, your next thought would have been giant cell tumor. Yes, giant cell tumor also occurs in the epiphysis, but the histology will be different. Okay. So you have a lot of mononuclear cells and giant cells. And what will be the X-ray appearance in GCT or giant cell tumor? You have a soap bubble appearance. So always you have to correlate the clinical picture, your X-ray and your biopsy. So all the bone tumors or cartilage tumors, it's very important you correlate with radiology. Okay. So epiphysis. So a long bone has got an epiphysis, metaphysis and the diaphysis. I hope you all know what is epiphysis, metaphysis and diaphysis. It's based on from which ossification it develops. Okay. So today you have learned about two lesions which occurs in the epiphysis. One is giant cell tumor, another one is chondroblastoma. So this again is a very important thing. So giant cell tumor occurs in the epiphysis. Chondroblastomas also occurs in the epiphysis. In metaphysis, you get osteosarcomas and chondrosarcomas, the malignant tumors, and in diaphysis, you can get Ewing sarcoma and multiple myeloma. Okay. So I hope this video was helpful for you. So a little bit extra points just for your interest. So I was mentioning about this chicken wire sort of calcification. Can anyone tell where else, in which other tumors you can see something related to chicken wire? Anyone? Yes, you can have it in myxoid liposarcoma. Myxoid liposarcoma, you will have chicken wire pattern of blood vessels. So look here, the blood vessels, all these are blood vessels. So the blood vessels look like in a chicken wire pattern. Okay. So this is just an extra point out of interest. So remember, chondroblastoma occurs in the epiphysis. Thank you.